providing timely, relevant content to providers who care for children. Welcome to Pediatrics in Practice, presented by Children's Mercy Kansas City. Here's Dr. Michael Smith.
Female reproductive health is critical in growing girls and young women, but knowing what and when to refer to a specialist can be difficult. This is Pediatrics in Practice, the podcast from Children's Mercy. I'm Dr. Mike. My guest is Dr. Julie Strickland, Section Chief of Pediatric and Adolescent Gynecology at Children's Mercy. Dr. Strickland, what is a pediatric adolescent gynecologist?
Thank you for having me, Dr. Mike. I would tell you that is often a question asked of me because of increasing awareness of the importance of reproductive health in girls of all ages, not just adult women. Pediatric and adolescent gynecology is a relatively new field within obstetrics and gynecology, and has recently just been recognized as a board certified focused practice within obstetrics and gynecology. Basically, pediatric and adolescent gynecologists look at the reproductive health and reproductive structures and possible diseases of girls at all ages, from neonatal life up through college age and generally. So we're prepared to provide consultation for gynecological disorders and disorders of reproductive function, all the way through the pediatric lifespan.
And what is the training that you underwent to become a pediatric adolescent gynecologist? And is this a fellowship of OBGYN, or can also pediatricians come into this fellowship?
So the fellowship is only of OBGYNs. The training is usually the general obstetric and gynecology training and board certification. And then new to this field is practice and experience beyond that of at least 3 years. And then setting for a focused examination, as well as an examination of practice case lists at the board level to delineate special expertise in this area.
And how many, if you know this, how many physicians from OBGYN are board certified in this pediatric adolescent gynecology? Do you know the number?
So it is a new focused practice, and the board has only been operational for about a year. In the first round of the board focus, over 200 people set for this examination and passed. I don't know the exact number, but I know it was over 200. So by that, then they have this special focus practice. There are many OBGYNs who are interested in both adolescent health care and public health and enjoy taking care of adolescents. But this focus practice is just beginning to sort of recognize that as a specialty among OBGYNs.
And I'm curious, Dr. Strickland, what was the reason you went into this subspecialty?
I think that I have always enjoyed taking care of young women. I've had a lot of experience and expertise in teen pregnancy and teen pregnancy prevention, and have had in my career a pretty large bent on public health. And as I began taking care of young women, I really saw a gap in that oftentimes many of the disorders were really things that really needed attention earlier. So I gained more and more expertise, working highly collaboratively at Children's Mercy with other specialties in pediatric surgery, pediatric endocrinology, and really forming a hybrid team of people to address reproductive abnormalities in children and adolescents.
And what are some of those common conditions that the specialist like yourself would actually diagnose and treat?
So we see children throughout all the lifespan. For example, in neonates, we would often evaluate ovarian problems, ovarian cysts, masses, congenital malformations that are identified at birth in the reproductive system. We often work with our pediatric surgeon with our rectal malformation clinic, as well as our your pediatric urologist. In the child, we take care of injuries, ovarian diseases, genital infections and irritations are a big common one of them, as well as dermatologic problems that affect the child. In the adolescents, it's more traditional gynecology. We treat menstrual functions. We're very interested in early diagnosis and treatment of endometriosis for our patients who present with pelvic pain and menstrual-related dysfunction. And we continue to treat girls throughout their teenage years, addressing issues of healthy reproductive function, sexually transmitted disease prevention, and pregnancy prevention.
And so, going back then to the general practitioner, the general pediatrician, obviously female reproductive health can be very complicated. And so do you have any advice for the general practitioner of when should they reach out to somebody like yourself?
So our whole specialty is set up to be a consultant, and it works best when we often work in combination with primary care physicians. We often partner with them. Many of our patients come from far away, and so that's optimal if we can partner with them. Different primary care doctors have different comfort levels as far as reproductive health care, so we try to be supportive at all those different levels. I think that we can always say that we feel that we'd love to see particularly patients who begin to develop menstrual dysfunction, that have problematic periods, either with bleeding or pain, and we appreciate so much the primary care doctors using that menstruation as an important vital sign. So it's often the time when we discover other problems of health. So we're always glad to see those patients and be a resource during all time periods. Likewise, in the neonatal period, we are often a resource to primary care physicians who do great exams and just see something that doesn't look quite right, and they're often very astute at diagnosing congenital malformations that are important to identify early, even if we don't treat them till they're older.
So fantastic information, Dr. Strickland. So in summary, what would you like the general practitioner, the general pediatrician, the community practitioner, what would you like for them to know about female reproductive health and the role of a specialist like yourself?
So I'd like for them to know, first of all, their own role, which is to continue to do genital exams throughout the childhood period, and to identify early abnormalities. And for us, we see our role as being very supportive and collaborative with primary care doctors to, if they identify abnormalities of growth and development throughout the childhood and adolescence, that we would like to be able to see those children. We think that early access makes a really big difference. And so just knowing that we're out there is the biggest thing that I'd like to convey, and that we would like to partner in healthy pediatric and adolescent care.
Excellent summary. That's Dr. Julie Strickland, Section Chief of Pediatric and Adolescent Gynecology at Children's Mercy. Thanks for checking out this episode of Pediatrics in Practice. Please visit childrensmercy.org to get connected with Dr. Strickland or any other provider. If you found this podcast helpful, please share it on your social channels and be sure to check the entire podcast library for topics of interest to you. And be sure to check back soon for the next podcast. I'm Dr. Mike. Thanks for listening.